Now let's talk about GFR. Inulin clearance can be used to calculate which clearance. Inulin clearance can be used to calculate GFR because it is one thing, freely filtered and neither reabsorbed, neither secreted. Okay, so inulin is freely filtered, and that's it is used for to calculate the GFR. And what is GFR? Well, GFR is the volume of fluid. Volume of fluid filtered from glomerular capillary into the Bowman's capsule per unit time. So volume of fluid filtered from the glomerular capillaries into the Bowman's capsule per unit time is called GFR. Okay, so for the so let's look at this. C, clearance of inulin equals GFR. Why it's equal GFR? Because it is not reabsorbed and not secreted. It is freely filtered, and which will lead to equals urine concentration of inulin times the urine flow rate divided by the plasma concentration of inulin, which equals Kf. Now you can look at this one, in which you have Kf as the constant, Kf as the filtration coefficient, GC is the GC for glomerular capillary hydrostatic pressure. PBS is the Bowman's capsule hydrostatic. P equals the hydrostatic pressure. Hydrostatic pressure. Okay. And then the other one, you have the again minus the pi GC equals the glomerular capillary oncotic pressure. So P equals hydrostatic pressures, and that pi, or whatever you want to call that, that equals this oncotic pressure. So the oncotic pressure for the glomerular capillary and the oncotic pressure of basement, my bad, it's called the Bowman's capsule, in which this one, the Bowman's capsule, normally equals 0. And here, this is the coefficient, filtration coefficient. So this is just the math. But here now, what is the normal GFR? That is about 100 milliliter per minute. 100 ml per minute. Creatinine clearance is an approximate measurement of the GFR. Why? Because it slightly overestimates GFR, because creatinine is moderately secreted by the renal tubules. So because it is secreted a little bit, it overestimates a little bit of the GFR, but roughly it can tell you your GFR. What can tell you your GFR? Creatinine clearance. And how much is it? Is overestimating about 10 to 20%. So you can decrease that 20-20%. You can write and go back to your actual GFR. Okay. So decrease in GFR or incrementally decrease in GFR defines the stages of chronic kidney disease, CKDs. Look at this graph now. We have the plasma creatinine and then we have the GFR. So we mentioned that the creatinine overestimates slightly the GFR, right? So if we have about 2, and let's say this is 1, at 1 creatinine, we have about GFR 100. Okay. So even if you don't look at that, just remember that the creatinine slightly overestimates while the inulin is directly filtered. So it's a proper way to go for 100% what the GFR is.